As I said at the top of the show, we're going to talk about child well-being in North Carolina. And we have a terrific guest up first to talk about some of the key facts and indicators about child well-being. We have Laila Bell. Laila is the Director of Research and Data at NC Child. And as I mentioned, NC Child is a nonprofit that advances public policies that improve the lives of North Carolina children. Thank you for being here.
It's great to see you, Keith.
All right, so let's just start out. Let's sort of set a little sort of the baseline for our viewers. What is child well-being in your organization's view?
It really refers to whether or not children have those basic building blocks that enable them to be healthy, to be successful, and enables them to thrive as they transition to adulthood.
Now, one of the reasons why I invited you on the show is just a couple of weeks ago, the Annie E. Casey Foundation released their annual index, and they rank all the states and sort of how they're doing. I think we're going to have some data maybe on the screen, but also in some of our breaks. So how did North Carolina fare in that index, and kind of just tell us a little bit about what the components of that are?
Right, so the Kids Count Data Book is an annual analysis that's produced by the Annie E. Casey Foundation, and it creates comparable state-level rankings of child well-being. And it looks at how children are doing in 4 different areas. So economic well-being, education, health, and family and community. And in this year's data book, we saw that North Carolina ranked 33rd in the country for overall child well-being. So that really pushes us to the bottom half of the country in terms of how well our children are faring.
Right, and so, I mean, so the purpose of getting this information out, I guess part of the reason is, one is to raise awareness, but you're talking about policy. So when you look at those areas, and I'm looking at some of the charts right now, when you talk about economic well-being, education, health, I mean, what are the things that, in your view, pose the greatest threat for children in North Carolina today?
Well, North Carolina's poorest showing was really in the economic well-being domain. We ranked 37th in the country. We saw some modest improvement in those indicators, which include things like child poverty, the percent of children who live in a home where their parents lack full-time employment, whether or not they're living in homes that have a high housing cost burden, which essentially means they're living in homes where their housing costs gobbles up an increasing proportion of their budget. And finally, our percent of young people who are either out of school or not working. When we look at the data, we saw some modest improvement in all of those indicators, but the context here is critical. Right. North Carolina ranks 13th in the nation for child poverty. We tie with a couple of other states in that area. 1 in 4 of our kids live in poverty, and we fare far worse than the national average in this area. And it's concerning because we know really poverty is one of the most negative and damaging experiences in terms of children's healthy growth and development. It affects their future academic outcomes, it affects their future health outcomes, it even affects how successfully they transition to the workforce. Right. So this is a significant threat for kids and families in North Carolina.
And I know we look at it at the Public School Forum, we focus on poverty too in terms of educational outcomes. And one of the concerns we've been tracking, like school finance and other things, is that some of these things feel almost structural now. They're really locked in. It's been referred to as 2 North Carolinas. We're filming this show today here in Wake County. I mean, this is a booming area. Obviously, there's poverty here too. But you just drive 1 hour east toward the coast, and it's really a different state.
That's exactly right. And so in a different domain, we have an indicator that looks at the percent of children living in high poverty neighborhoods. And what we're seeing is that poverty in North Carolina is becoming increasingly concentrated. About 14% of kids in our state live in a high poverty area. This is significant because those high poverty areas are less likely to have things like grocery stores that enable parents to purchase healthy and nutritious foods for their families. Those are communities that are more likely to have under-resourced schools, that are more likely to experience things like community crime and violence, and all of those really have an impact on children's healthy growth and development.
Are there some areas that were rated that we're actually seeing some improvement? I mean, the whole country went through a terrible recession, 2008, 2009. We've recovered in a lot of ways, but are there some areas that have improved?
Well, that's exactly right. We saw the recession that pushed up child poverty in the state. We're seeing that families haven't really recovered in terms of their economic well-being. But the data book also shows a significant improvement in the percent of children who have health insurance coverage. So about 96% of children in North Carolina currently have health insurance coverage, which means we are approaching near universal coverage. And this is significant because health insurance coverage is kind of one of the basic kind of things that children need in order to achieve their best health and well-being. It enables them to get healthy child checkups, to make sure that they're getting preventative care, which means that they are staying in good health versus having to go to an emergency room and trying to address these kind of costly illnesses that occur when children don't get their preventative care and checkups.
Right, right. So is that, so that's obviously an area that we've seen a little bit of improvement. Is there a concern? I mean, look, you can't turn on the news. There's obviously a big national debate about health care. They're concerned that we might take a step backward on that with some of the things that are being talked about?
There's a significant concern about how federal health care reform will affect children's access to health insurance here in North Carolina. So we cut the percent of uninsured children in North Carolina by 50% since 2010. And we know how we did it. We know that the Affordable Care Act was a significant factor, but we also know that Medicaid and the Children's Health Insurance Program help more children be able to have health insurance coverage. So any changes that happen at the federal level will have significant impact here in North Carolina. For example, the Senate released its own version of Obamacare repeal and replace. We saw that the bill would create some cuts and caps to Medicaid that would essentially create a loss here in the state and could potentially affect eligibility and children's ability to get on that program.
Right. Well, we'll obviously have to keep an eye on how that affects them. People can find out more if you want to read more about this study and about the work you're doing. They can go to ncchild.org. Is
That's
that right?
right.
Great. Well, Laila, thanks so much for being here. We appreciate you setting the stage for us. We're going to talk to Secretary Cohen next about some more state-specific things. But before we go to break, see if you can answer this question, true or false? And I think we just answered part of it. Since 2010, the number of children in North Carolina without health insurance has doubled.